My name is Jill Weida. I'm a family nurse practitioner and I work with GYN Oncology. I've always wanted to be a nurse, so kind of from childhood, that was my answer to the question, that typical question, what do you want to be when you grow up? My answer was always a nurse, so it was a pretty easy decision. I have a fairly significant family history of cancer. My mom actually was diagnosed with pancreatic cancer when she was 40. So she passed away about 4 months later, but watching the physicians and the nurse interact with my mom, with me, my sister, my dad, was really a gift and really made me know what I wanted to do, and I wanted to be able to pass that on. Actually, when I was 38, I was diagnosed with ovarian cancer. I had a hysterectomy and then went through 6 months of chemotherapy. 2 years later, I was diagnosed with thyroid cancer. Had my thyroid removed, had some radiation treatment, and I think it just gives me a unique perspective with patients that I actually know what they're going through, can truly say that I know what you're going through. I think listening to them. We really take the time to ask questions, to get to know them, to know what their fears are, what they're worried about. Are they, do they have good family support? I want to know what's happening with them so I know how to help them the best. Everything. It's interesting when someone asks where you work and you tell them that you work in GYN Oncology, the immediate response is, oh, that must be so sad. And I feel the exact opposite. You really get to know patients and their families. You don't see them once. You see them, several times. So you get to know everyone, and it's just really an honor to be part of that patient's life at that time. Oh, a lot. I stay very busy. Love to travel. I went to actually Ireland this summer. It was absolutely beautiful. I like anything with water. Boating, swimming, skiing. If there's water involved, I'm involved. I like to run. I do CrossFit. I have 4 nephews and 1 niece and spend a lot of time with them and watching them grow up very, very quickly.